Hello, everyone. I want to give it just a moment while all of our attendees are connecting to audio, but welcome and thank you for joining. Hi, everyone. As everyone is connecting to their audio, I just wanted to kick us off today. Welcome. My name is Brooke Akins, and on behalf of Q1 Productions and LexisNexis Risk Solutions, I'd like to welcome you to today's webinar and thank you for joining us. Today's webinar will discuss optimal patient outcomes, beginning with better data. And thank you again to today's sponsor for developing our content, LexisNexis Risk Solutions. We love working with you guys. We're very lucky to have Sean Larson, who's the Senior Director of Healthcare Strategy at LexisNexis Risk Solutions with us today. And Sean will be providing new insights and visibility into how life science companies can remain competitive. He'll detail how medical claims data can transform strategy, business development, and reimbursement negotiations to focus on patient-centric care. And finally, he'll illustrate how to improve patient outcomes by analyzing population health data and analytics to intervene proactively rather than reactively. Just a word about our sponsor, LexisNexis Risk Solutions is passionate about leveraging data and analytics to connect healthcare organizations and the patients they serve in meaningful ways. By applying proprietary technology and advanced analytics to their rich data, they deliver actionable insights to healthcare clients to empower informed decisions, helping to ensure compliance, improve financial results, and serve better health outcomes. Headquartered near Atlanta, Georgia, LexisNexis has offices throughout the world and is part of RELX, a global provider of information-based analytics and decision tools for professionals and business customers. Please note that a copy of today's presentation recording will be provided to all registered attendees, and there will be an option or an opportunity, to get your questions answered by Sean once he's finished speaking. But please feel free to submit those questions and comments to Sean at any time during the presentation via the Zoom Q&A bar that's on your, Zoom Q&A option on your toolbar. If anyone does not have email right in front of them, please feel free to submit those questions and comments directly to me to webinars@q1productions.com. I encourage you to be as specific as possible when submitting questions and comments to Sean. Please feel free to include an example or reference back to a particular area within the presentation to better assist him in thoroughly answering your questions. Without further ado, I'd like to introduce today's speaker, Sean Larson. Sean serves as the Senior Director of Healthcare Strategy for LexisNexis Claims Analytics Solutions and has more than 25 years of experience developing database solution selling models and advanced data mining solutions for both B2B and B2C. Prior to LexisNexis, Sean spent 11 years with Medtronic, leading business insights and analytics teams focused on building internal and external stakeholder deliverables that increase growth through patient access or reduce costs by optimizing people, process, technology, and data. At this time, it's my honor to hand it over to today's speaker, Sean. Welcome and thank you for being here.
Thanks for the introduction, Brooke, and thanks for taking your time to spend with us today as we talk about how LexisNexis can help you and your business manage patient access through really understanding the care continuum. And what I'm going to talk about is how we today enable that process to be more visible within your organization, and I'll walk through the steps on how we get there. But really, as you think about managing a patient, there is a process that a patient goes through to get to any individual end state solution that a life sciences company provides, whether that's a procedure or a tool that helps with diagnostics or even potentially drugs. So I want to talk about how we get to that point of making each one of those decisions more visible at each one of the patient touch points, and then really dig into how you can influence that care continuum. So really, what is it all about? It is about looking at a claim. And we at LexisNexis have two sides of the claims that we analyze. So we're really looking at the diagnostic and procedure claims that are submitted from a provider to a payer. And then we pick up what the payer actually pays to the provider. And there are hosts of insights that we can capture from that, such as the CPT codes, the ICD-10 codes, diagnostic and procedure codes, inpatient, outpatient. We capture both government data sources and commercial data sources without a geographical bias. So we're able to really understand what's happening across the entire country. And we're focused on US data here, but we have the widest breadth and depth of claims data consolidated for utilization to understand these metrics. We have patient information around age, gender, and location. We have payer insights, again, from every payer across the country. And we have the level of what the payer paid, the host of statistical metrics around mean, median, and mode around the payers. And we have the denial codes that a payer actually provides back to the provider if the procedure is denied. We have insights around the physician, the HCPs treating the patients, how patients are managed across those connections between physicians, and everything that happens within a facility. And tying all that together, we were able to look at where a physician does most of their workload at a facility. And we can look at that and try to identify primary, secondary, and admitting based on those claims inputs. So really what makes up our ability to provide detailed insights is around how we take all of our data sources and blend them. So we really collect data from over 10,000 sources. And that is our entity engine. And as that entity engine collects information from multiple different inputs, we feed that into our claims data environment. We have over 11 billion records in our claims data environment, and that has roughly 2.2 billion claims coming to us on a yearly basis. And to build out a comprehensive data solution, we really need to look at, as I mentioned, pulling together both the governmental data sources and commercial data sources. And there's as much of an art as a science to doing this. We have about 15 years of experience of blending these data sets and projecting to 100% market capture. We believe that we have the most comprehensive and accurate listing of what's really happening at the providers. And providers tell us that because they use us as one of their key sources for understanding not just what's happening within their markets, their IDNs, and their referral networks, but being able to look at that data and say, yes, this is the most aligned to what my data tells me internally. And so it's that validation that helps us move forward with providing a check and balance on our capabilities for our output. Now we have over 400,000 facilities with active claims, but we have 1.3 million facilities in our environment with over 1,000 IDNs in our provider master file data set. We are pulling over 2.2 billion claims a year, as I mentioned, and 240 million unique patients. The data is available for utilization as soon as 3 days after we capture it from our switches and clearinghouses. And roughly 78% of our data comes through switches and clearinghouses on a daily basis to LexisNexis. On top of the 15 years of experience consolidating this data and an ongoing investment in data assets, we've developed a unique expertise in identifying co-occurrences, complex logic and coding that allow us to really look at things in a way that is very difficult for most healthcare data providers to offer. Because you have to really understand the complexity of multiple diagnostics or potentially a cadence of diagnostics with a procedure to really truly articulate what's happening within a given marketplace. And that capability is enhanced in our output and our customized research that we offer. So one thing I wanted to share with everybody, as we are looking at all of this data and how it relates to your patient base and how they relate to your customers, the providers that you work with. We know that patients flow from least invasive procedures to most invasive procedures. At each one of those touch points, we see some sort of interaction that we might be able to pick up within our data model. And I want to just share one specific use case with you. This is a use case that's near and dear to my heart. I spent many years helping support this business in my former life. And it's a great example of how you really need to have details around how a patient moves through the care pathway to really understand how you as a life science provider can interact with all of those healthcare providers that are managing and treating patients. So this is an example of a geographical location where we have roughly 130,000 patients who have back pain. Think about this from a nationwide perspective. This could be as many as 130 million patients. But again, we want to zoom in a geographical area because this would be the catchment area that a provider would be looking for. And you working with that provider as a device or a pharmacy or a pharmaceutical provider would want to know who is treating patients in my area of interest. So think about anytime any one of you has an ailment. If the ailment is serious, you might go and look on WebMD, and you might do some self-diagnosis. You might pop some NSAIDs, ibuprofen, maybe Tylenol, maybe Aleve. That might work for a couple months. So you're in that initial 130,000 patient cohort. Say at about 3 months into it, your pain doesn't get any better. And you talk to some friends and family, and now you're getting a feeling that you should do something more and really go see someone about this. So you bring in your primary care provider. Your primary care provider evaluates you, and some of those patients, say maybe 30,000 of those patients, might be okay. They might just, their primary care provider might say, you know, you're good. You just have a swollen muscle, you know, keep doing the NSAIDs, maybe an ice pack. But 100,000 or so of those patients might need to go on to further care. So then what do? We have an X-ray. At this point in time, I start to pick you up in my data as a patient. Not only do I see the lumbar pain diagnosis that comes from your primary care provider, but I'm also able to pick up imaging done as a procedure on your profile. And we're also able to see what was remitted. So I have the diagnostic and procedural data submitted. I'm able to see what percent of those patients were actually denied any coverage in this case, or what the patients were paid, what the procedures were paid for by the insurance provider. As the patient's care pathway lengthens, we get into roughly about 6 months, and they're coming back to see their primary care provider for a follow-up. Now say we've got about 90,000 patients in this follow-up cohort. Some of those patients will be fine after seeing their primary care provider. Minimally invasive care has done its trick. Some of them won't, and they may be referred on to some advanced treatments or therapies. So we might have physical therapy. That might take a month or so. That might work for some, that might not work for others. I'm picking up the physical therapy on a claim form. I'm also picking up a referral from the primary care provider to the physical therapist. That might solve the patient's problem, that might not. As time goes on, the patient might come back to the primary care provider and they're told, well, this didn't work, let's move on to the next line of therapy. So then we take you to the anesthesiologist, and potentially you have an epidural or facet injection, which again gets picked up on a claim form. The referral information gets picked up on the claim form, and then how much the procedure was actually reimbursed for gets picked up on a claim form. That may solve the problem, that may not. And then at about 12-month time period, now we've gone from that 130,000 patients in the initial cohort to about 50,000 patients. We may be referred on to pain management. There may even be some MRI interventions that need to happen. And you may be diagnosed as a more advanced stage of the given disease that we're talking about here, leading into spinal fusion. So you might be prescribed opioids for a short period of time. At some point in time, you might see a neurologist, and the neurologist might evaluate and say, you need to get off of opioids, there needs to be some other alternatives. Within this time frame, there are advanced pain management treatments that could be applied, such as spinal cord stimulators, a wide variety of different drugs, or you might be referred on to some sort of advanced spinal fusion or some spinal fusion care or spinal care, such as spacers. So this time frame, could be 18 months, it could be 24 months. At each one of these points in time where you have a diagnosis or a procedure, we're actually able to pick that up on a claim form. And so now, thinking about from a life sciences perspective, if you were the life sciences company that had the product for spinal fusion, what you would want to do is have a relationship with the neurologists that are seeing the patients that come through this care continuum. You would also want to know who the primary care providers were that were seeing lumbar pain patients and then referring them on for physical therapy, or potentially the anesthesiologist for the epidural or facet injections, or the pain management doctor for any of those procedures that they're working on, so that you can inform a patient through their doctor's office the options available to them. Because often from the primary care setting, the patient and even the primary care providers isn't always aware of the options that the patients have for end state treatment of a given disease. And clearly you want to provide your clinical evidence and your efficacy of the solution to the doctors, but we now show you where those doctors are practicing. We show you who they're seeing for which disease state, which diagnosis, which procedure. We're showing you reimbursement models. We're showing you which providers have a higher rate of denials based on the remit codes that we're able to pull. And pulling all of that together, including who is connected to whom in the patient care pathway, we're now able to show you how those patients are connected as they move from one of these diagnosis and procedural instances to another. At the end of all of these procedures, there's actually yet a cyclical process around patients that don't respond well to treatment. And these patients are picked up with a diagnosis of failed back surgery syndrome. Failed back surgery syndrome patients now loop back into the care continuum of a patient that is being diagnosed for the follow-up treatment. And it could be degenerative upper or lower levels that we now have to work through, and bringing the patient all the way back to the neurosurgeon for yet one more operation. But again, we're able to pick up all of that so you can help manage the patient access through any one of these touch points of interest for your product portfolio. So what kind of use cases would we actually be using here or addressing? So a key thing would be how many patients are on my market that could potentially be candidates for my procedures. You could use this to size the market and figure out, should I make an investment in this procedure that we're thinking about moving into? Or are there co-occurrences of diagnostics that happen with this procedure that I may need to have covered for my reimbursement? Are there opportunities for me to assess that and dedicate resources to getting that use case on label? This data can help you understand that. Looking at the procedures and diagnosis cohorts for any targeted growth strategy you might have. Understanding the competitive landscape. How do your procedures compare with patient volumes in the market? And on the provider side, how does the diagnostic base and procedure volume compare to competition? Similarly, you could leverage this data from a procedure standpoint and really tailor in on a CPT code directly tied to a product that you have, or an ICD-10 procedural code with inclusion-exclusion criteria of the diagnosis of interest to make sure that you're not picking up any erroneous procedures that might be related to other therapies, because we see that often in ICD-10 codes. And then apply an internal average selling price to figure out what your opportunity is. Mapping relationships between primary care HCPs and advanced patient management is a sweet spot of this data, helping you understand opportunities for growth and then even leakage. So the referral markets that are in any given marketplace are the doctors in the primary care settings capturing all of their referrals within a given IDN, or are we seeing patients being seen by a primary care provider end up being finally treated by an interventional physician or a surgeon in another IDN? And then knowing what's your relationship with that IDN can help you position how you get your products into those given IDNs. Mapping relationships between the surgeons and the interventional docs, primary care docs, is critical to being able to understand, what is your ability to capture patients. And again, doing this across the entire network. So looking at how patients move from a clinic to a hospital, shared patients between the primary care providers, the secondary line of care, and then end-state surgeons. Looking at the networks, understanding where did patients go? Who are the key market influencers in your network? Understanding how those patients either stay with your doctors that you have a relationship with, or potentially move on to a physician that you don't have a relationship with. And being able to understand that and get in front of those physicians and have those conversations is really key in maximizing how your patients are managed within your care continuum. So a product that we're developing internally is really addressed around care continuum management. And we have a question outstanding to the attendees today to help us name this, for lack of a better ask. We, as I stated, we watch the patients as they move through the progression of primary care provider, through interventional medicine, through end-stage surgeons, and then back around, as the example I just gave shows. We're able to track the volumes of patients that move through this care continuum currently, and see where volumes fall off or pick up. And there are different ways that we look at the concept of care continuum or patient pathway. Our data set is a de-identified data set that shows identified physician, facility, the volumes, et cetera. We're able to look at the relationships between the patients internally, but we're not providing the patient ID in any of this data set is for our current offering. So does that truly fit the bill for what would be considered a true care continuum? Or is this something more along the lines of patient access insight or something like that? So this is an example of what some of this data would look like. So as we see our data, we have attributes around the physician, where they're doing their practice, what is their workload at a given facility. So you can identify when a physician's primary facility is for a given diagnosis or procedure. And if you think about it from a sales rep perspective, if a sales rep had to figure out where they were going to have a conversation with a physician about trying your product, getting a surgery on the books, often that conversation happens in front of the scrub sink. So which scrub sink is the scrub sink that your physician of interest is going to be in front of the most? This can help you identify that. Looking at things that might be some relationships that you can take advantage of, such as where did they go to medical school? When did they graduate? Again, which hospitals do they practice at? Are you on contract with those hospitals or not? Internal conversations that you want to have as you plan your territory. And again, the connectivity between these physicians. So how many physicians are sharing patients, and what is that breadth and depth of market share look like? And then on the reimbursement side, again, so of these procedures, how are they tracking as far as how the physician is getting reimbursed? So are there some procedures that are in the marketplace that are better at being reimbursed than others? Are there some payers that do a better job of being reimbursed? And again, I'll talk about this in a minute, but it helps you identify and hone in on your strategies of how you segment your market and how you prioritize which of the physicians and facilities you spend your time developing. We're able to also look at new modalities. So we have traditionally been looking at brick and mortar settings, and much data in the marketplace right now is focused solely on that. You'll see that there's a fair amount of telemedicine that's been happening, and especially since COVID hit last year, we saw incredible lifts in telemarketing from where we used to be, or telemedicine from our pre-COVID baseline. And while we've stabilized over the last several months, it's pretty clear that telemedicine is here to stay. We're picking telemedicine as a setting of care up in our data set. So we're able to now look at telemedicine in a network, and you can identify where patients are being seen more for telemedicine than others, the relationships of telemedicine and doctors that might be doctors of interest that you're calling on, and being able to really differentiate the modality of how patients are being treated. As I mentioned also on the payer focus, we're able to take within this data and identify the payer mix of each one of the individual HCPs. And this can help with your segmentation strategy immensely. So if you have an offering where you want to increase your indigent outreach efforts, you can look at a cohort of patients that are high Medicare or high Medicaid reimbursement at each physician level. If you're interested in high commercial payer, we could do the exact same in that case. So when you're looking at a physician that you want to build a relationship with, think about this as a fish finder. For instance, if I'm going fishing in a large body of water and I want to optimize the amount of fish I capture, I want to be above the biggest set of fish that are available. And as I'm looking at leveraging and triangulating all this data, essentially what it's saying is these are where the most aligned to your strategy opportunities exist to build and foster relations with the patients that are most likely to be your patients of interest based on either a diagnosis code or a procedure code that you care about, or again, that complex intersection of diagnosis and procedure codes, co-occurrence of diagnoses, adding to it a layer of payer mix, place of service, setting of care. We can really help you dial in on getting to the most refined view of where your patients exist, where your potential patients exist in that care continuum across all of those HCPs. An additional component, this is relatively new in the marketplace, where we're having trends of prior authorization and denials. While prior authorization has been around for a long time, we're seeing in areas where there are some payers that have a higher hurdle or bar that needs to be reached for a patient to get the therapy of interest. So we can leverage this data in a couple different ways. We can identify where those patient cohorts exist the greatest within our data set, and then create some sort of outreach program that really digs into reducing those hurdles and barriers, which will help all patients at the end of the day. Or we can choose to focus on the areas where we have the lowest threshold of burden for prior authorization. And again, as we break out our physicians and HCP models, as you look at how a physician is aligned to your target procedures, your key patients, your key HCOs, and the key HCPs, drilling into this would allow you to really get to the most amount of patients and providers in a geographical area that have those segment components of interest. If you have a payer that you've identified that is more difficult to work with, then ideally what you would want to do is limit the amount of interactions you have with that provider and maximize the amount of relationships you are building with the providers that have a payer that has a higher likelihood of not having such a high bar for prior authorization. So what I've done is pulled together an overview of how the LexisNexis market view claims can help you address a wide variety of questions around managing, getting access to patients and managing them across your care continuum, not just at the procedural state, which is where we spend a lot of our time on the life sciences side, but also moving upstream of that care continuum to working with the interventional doctors, working with primary care providers, even nurse practitioners and chiropractic patients across that care continuum to really maximize the messaging that you provide to the marketplace and enhancing your capabilities to get options to all the patients, as many patients as possible. Okay, so now I'd like to open it up for some questions. And first of all, I want to thank you again for taking the time to connect with us today. So a question around data and how frequently the data is updated. About 78% of our data is updated daily. So not real time, but daily. And then we process that and make it available through a product called Early Alerts as soon as 3 days after the data comes into us. And an interesting use case, one of my favorites in this space is there was a medical device company that had a procedure that was done that was a precursor to a procedure of interest for surgery. And we were able to pick up that procedure 3 days after the physician saw that patient. And the sales team was able to connect with the physician and have a conversation with the surgeon around, did you know that these are the options? And they were able to schedule their procedure for the patient. Again, they had all the inclusion, exclusion criteria, but they were able to schedule that procedure with a patient within a week of seeing them in the data. I find this is absolutely fascinating. And again, some people might think that this is kind of a big brother thing. I don't think it is. I think this is really leveraging data to help patients get access. And access, a big piece of access is really awareness. If the patients are aware of their options and making the decision with their doctors, decide to get your therapy, if you have the clinical evidence to back your therapy up, all you're doing is aligning the stars. Another question I have is, what was the comparison outlined in the pie chart in slide 13? The comparison slide 13. So this is looking at two different cohorts of patients at a physician level. So think about all the physicians in your marketplace. One snapshot is a snapshot on the left of a physician who has 78% Medicare patients, 9%, 10% commercial, 12% Medicaid. On the right, a physician has 64% commercial, 5% Medicaid, 5% or 31% Medicare. So as a segmentation capability, what we're showing you is what that mix looks like. And we know that the physician has patients of interest. Think about it, if the physician had 100 patients of interest in each one of the locations. If your model was going after the indigent population, or you needed to increase some internal metrics around treating patients on Medicare, what you would do is you would focus on building relationships with the physician on the left side of the equation because they have the most amount of patients that meet that criteria. If your criteria is enhancing your commercial strategy or looking for physicians with a high level of commercial pay, you would go and focus on the physician with the patients on the right side of the equation. Hopefully that answered that question.
Thank you, Sean, so much. And I've got another quick question that's coming through the chat. I would ask our attendees to drop those in the Q&A so all of our panelists can see them, but no worry for those that have dropped in chat. Sean, this question was asking, is this data specific to North America or US specific?
That's a great question. It is specific to the United States.
Thank you for clarifying that. And everyone, we do still have time for questions, but before we jump into those, I did want to launch two just quick polls here. The first one, as Sean had mentioned, we're looking for a name for the product. We're focused on care continuum management. I feel like Sean was dropping a lot of buzzwords that just had me thinking while we were running those. So we do want your feedback. I'm going to launch this poll, but again, our chat is open. So again, launching right now, LexisNexis is finalizing the product. They're testing different product names for the offering. Based on what you've heard today, what would you name the product? Again, please submit these in the chat below. We could not do an open-ended question in the poll, but please feel free to drop your naming suggestions in the chat, or feel free to follow up with myself or any of the LexisNexis team directly. We're looking for your ideas on how to name the product, thinking about care continuum management. That is our first question. And again, we would welcome any options submitted in the chat. There are no bad options here for our creatives. And then again, this is just our first in a series of webinars. If anyone would like to be pre-registered for our next session, which is going to be in the coming weeks, likely probably early October, I'm just going to launch this poll real quickly. If you would like to be pre-register, we'll be going into further detail on the claims, care continuum, and so forth. Please feel free to just select yes or no, and we will get you pre-registered or keep you abreast of other information on upcoming webinars. Again, I'll keep this one open for the next few seconds or so. Let us know if you'd like to participate in the future or if you have any naming suggestions for the product. We also do still have a few minutes. If you have any further questions or comments for Sean, please do feel free to drop those in the Q&A section. And I'm going to close this poll off in just about 5 seconds or so here. Thank you to everyone who participated in that. Sean, I know we've hit on a few questions, just throughout while we're waiting for these to come in. Any further thoughts on, I know we've got a number of medical device companies in the audience, and you're using quite a few examples for those. Any other thoughts today?
Yeah, I would, some questions that have come up in the past around this data, and this is interesting. I've been a consumer of this data set, claims data in general for, as you were mentioning in the beginning, Brooke, a little over 11 years. And I've also been working with providers directly on helping analyze their data. And for those of you that have been in that situation, have had those opportunities, you're not surprised to know that from the provider to the payer, there are a whole lot of things that happen within the data that mostly it goes right. Sometimes it doesn't. But matching a unique patient across clinic to hospital to emergency room, etc. That is as much, again, an art and a science on the provider side. So people ask me, is this, how accurate is the data? Well, the data is as accurate as it comes from the provider. And, we see that validated time and time again as our providers, as our provider customers purchase our data more often than any other source. and they do that directly through us, or they do it through other avenues such as Crimson Advisor and things like that. But I would always caveat that again, this data is as good as it comes from the source. And while we believe it has a very high level, we have a very high level of confidence in the individual physician volumes and the facility volumes. Nothing is absolutely perfect. And leveraging this data for what it is to help tell the story that I was just mentioning, and through that spinal fusion care continuum example, and looking at all of those opportunities within that care continuum to touch a healthcare provider that is managing patients throughout that cohort and increasing the amount of patient access that you are able to provide your own internal networks, stakeholders, and leveraging that to be able to identify what we think the market looks like from a holistic perspective, and then subtracting your own data from that to give you an opportunity assessment. Those are the key things that I think we really are optimized at solutioning here. Even though, again, the data is not always 100% perfect, but we do strive to make sure that is as close as possible to what's accurately reflected in what's happening at the providers. And we do get feedback from our providers that help validate that.
That's great. Thank you for that. I'm not seeing any further questions come through, but again, if anyone would like to submit a naming suggestion, we are game for any suggestions there. So please feel free, again, if not to drop in the chat. I will be in touch once we get off the line with a copy of today's presentation recording. Of course, if you have any further questions or comments for Sean Larson or the LexisNexis Risk Solutions team, please don't hesitate to reach out. I'll also be in touch with a survey just to get everyone's feedback on today's presentation. And as we build future sessions within this series, we certainly would welcome and appreciate your feedback. But thank you again to all of our attendees for making the time and participating today. We certainly appreciate your consideration. And a big thank you again to today's sponsor, LexisNexis Risk Solutions, specifically Sean Larson, who's the Director of Healthcare Strategy at LexisNexis Risk Solutions. Sean, very interesting, detailed information here today, and looking forward to the next sessions in the series where we can dig into this a bit more.
Thank you, Brooke. Thanks, everybody.
Of course, want to wish everyone a wonderful rest of the day. Again, any further questions or comments for our speakers, please don't hesitate to contact me directly at webinars@q1productions.com. Thank you so much, everyone. Be safe and be well and have a lovely day. Bye-bye.